Today's top stories. SARS-CoV-2 infection raises SAB mortality risk. How to find the sweet spot for cardio and strength training. Healthy diet may aid lung health in asthma and COPD. A lot to say. Doctors use comics to deliver best medicine. Opinion. I studied Reddit forums on menopause and found what doctors are missing. A state gave sheriffs 20% of its opioid settlement cash. We followed the money. RFK Jr. said a Samoa trip had nothing to do with vaccines. New documents refute that. Eating more ultra-processed foods may raise prostate cancer risk by 30%. Smart nanoparticles light up brain cancer and destroy what surgery misses. And vitamin C won't prevent most colds, but it may do one small thing. We start with SARS-CoV-2 infection raises SAB mortality risk. SARS-CoV-2 infection raises SAB mortality risk. TOPLINE recent SARS-CoV-2 infection more than doubled the risk of death among adults with Staphylococcus aureus bacteremia, SAB, during 2020-2022, with hospital onset, cases reaching mortality rates of 75%. Mortality rates rose by 33% for methicillin-resistant S. aureus, MRSA, cases, and by 41% for methicillin-susceptible S. aureus, MSSA cases from 2019 through 2021. Methodology. Researchers analyzed active, laboratory, and population-based surveillance data from 20 counties across 7 U.S. states to examine annual trends in mortality rates among adult patients with SAB during 2005-2022, both before and during the COVID-19 pandemic. A total of 72,920 SAB cases and 15,114 deaths were included, comprising 54,043 MRSA cases with 11,692 deaths and 18,877 MSSA cases with 3,422 deaths. Cases were categorized by epidemiologic class. Hospital onset, if incident culture was collected greater or equal to 3 days after hospitalization. Healthcare-associated community onset, HACO, if collected in outpatient setting or 3 days after hospitalization from patients with healthcare risk factors, or community-associated CA, if none of these criteria were met. Recent SARS-CoV-2 infection was defined. How to find the sweet spot for cardio and strength training. Don't cardio yourself to death. The Dreadmill, Cardio Queen. Cardio is taking a bit of a hit these days as strength training edges itself into the spotlight. While the latter is absolutely deserving attention and its rise in the cultural conversation is long overdue, it shouldn't be at the expense of cardio. Aerobic activity has indeed been downplayed lately, said Bradley Schoenfeld, Ph.D., CSCS, strength researcher and professor in exercise science at Lehman College in the Bronx, New York. But there are huge health benefits to having an efficient and fine-tuned cardiovascular system, he said. Beyond heart health, cardio benefits your lungs and, well, your whole body to some degree. Cardiorespiratory fitness is correlated with longevity, Schoenfeld said. Stephen Rainalone, CSCS, FRCMS, FMS, exercise physiologist at Hospital for Special Surgery in New York City, agreed. We swing in one way and then we swing the other way, he said about fitness and wellness trends. For example, one day eggs are good for you, and the next they're lethal. Social media rarely helps these messages. The same could be said for the conversation around cardio. It's been touted as a necessary evil. Healthy diet may aid lung health in asthma and COPD. TOPLINE, a healthier diet was linked to better lung function in adults with asthma or chronic obstructive pulmonary disease, COPD, compared with those without either condition. It was also linked to a slower decline in lung function in adults with COPD, compared with those without COPD. Methodology. Researchers conducted a prospective cohort study using data from the Lifelines cohort in Netherlands to determine whether the association between diet quality and lung function differed according to asthma or COPD status. The cross-sectional analysis included 83,460 participants, and the longitudinal analysis included 37,752 participants, with all participants having valid dietary and spirometry data. The mean age of the participants ranged from 44 to 46 years, and about 59% were women. About 9% had a diagnosis of asthma and 15% had COPD. Dietary quality was quantified at baseline using the Lifelines diet score, which covered 12 food groups range 048, and was derived from a 110-item food frequency questionnaire. Higher scores indicated a healthier diet. Lung function was measured using prebronchodilator spirometry, with measurements of forced expiratory volume in 1 second, FE. A lot to say. Doctors use comics to deliver best medicine. As a child, Nathan Gray, MD, dreamt that he'd grow up to become Batman or at least a superhero cartoonist. Instead, he traded his sketchbooks for textbooks and went to medical school. Life as an early career doctor, however, didn't extinguish his need to make art. It just gave him more stories to tell. During a keynote speech at the Graphic Medicine 2026 conference in Baltimore, Gray recalled finding himself swirling into this tunnel of diagnoses, tests, labs, learning about the science. But something was missing, and I got aggressively bored or burnt out. So I started doodling late in my residency again because I had a little bit of free time and a lot to say. Over the 3-day conference, Gray, now a palliative care physician and associate professor of medicine at the Johns Hopkins University in Baltimore, and more than 200 other attendees shared how graphic medicine, the use of comics in healthcare discourse, can help patients and clinicians convey medical information and bring attention to often overlooked conditions or experiences. Combining data, art, and dialogue, Gray has used comics to debunk public misconceptions about cardiopulmonary resuscitation. Explore the Changin. Opinion: I studied Reddit forums on menopause and found what doctors are missing. In forums on Reddit, women share tales of having perimenopause and menopause symptoms misdiagnosed or dismissed as mental health disorders, early-onset dementia, or autoimmune issues, resulting in months or years of unnecessary testing. They discuss sudden mood shifts of rage and panic, and how they are routinely labeled by their doctor as primary psychiatric conditions rather than hormonal fluctuations, leading to unnecessary antidepressant prescriptions. Severe brain fog, memory lapses, and sleeplessness from night sweats, all common signs of menopause or perimenopause, often terrify women into believing they have a degenerative cognitive disease before considering that these seemingly disconnected symptoms might be related to perimenopause or menopause. These conversations are not just chatter. They are scientifically important. Because they are not responding to a questionnaire written by a researcher, they might be able to offer important clues. What might medicine be missing if it isn't listening? In a study my colleagues and I published recently in JAMA Network Open, we compared menopause-related discussions from one of the world's largest online menopause communities on. A state gave sheriffs 20% of its opioid settlement cash. We followed the money. STAT is co-publishing this article by KFF Health News. Every state is receiving opioid settlement payouts from companies accused of flooding the nation with prescription painkillers and fueling overdose deaths. But only one state is directing 20% of those payouts to sheriffs, the largest carve-out for law enforcement nationwide. In Louisiana, sheriffs are elected, do not serve at the pleasure of another local official, and have independent budgets. They're also not required to proactively report to the public or another authority how they spend billions in opioid settlement cash. Short of filing public records requests or waiting for official audits, that has made it difficult for the average person to track the windfall. Many consider the dollars to be blood money and believe the spirit of the settlements is to spend it all on abating the addiction crisis. KFF Health News worked with 3 Louisiana news outlets, The Current, Gulf States Newsroom, and Verite News, to track those dollars. The newsrooms contacted all 64 Louisiana sheriffs over 5 months, often filing public records requests to produce the first detailed accounting of millions spent. The findings include T. RFK Jr. said a Samoa trip had nothing to do with vaccines. New documents refute that. New York Health Secretary Robert F. Kennedy Jr. repeatedly told lawmakers who held the key to his confirmation last year that a 2019 visit to Samoa before a deadly measles outbreak had nothing to do with vaccines. New documents obtained by the Associated Press and The Guardian refute that testimony. Kennedy, then a prominent anti-vaccine activist, preceded the visit with a letter to the Samoan Prime Minister requesting to study the Pacific Island nation's measles, mumps, and rubella vaccines after the deaths of 2 children who had received them. In the letter, he used the words vaccine or vaccination 8 times. The letter raises questions about how truthful Kennedy was in testimony before Congress. During an arduous confirmation process where he needed the support of some skeptical Republican lawmakers to advance, Kennedy also pledged to maintain vaccine policies that, once in office, he moved to change. "I am writing this letter to you in the hope that we might be helpful to the people of your great nation," Kennedy wrote, adding that he believed the deaths of the 2 children could have resulted from manufacturing issues. "I would propose my team conduct detailed health in. Eating more ultra-processed foods may raise prostate cancer risk by 30%. Eating more ultra-processed foods may raise prostate cancer risk by 30%. Date: August 27, 2026. Source: Florida Atlantic University. Summary: ultra-processed foods make up a huge share of the American diet, and new research suggests they may carry another serious health risk for men. In a nationally representative study of more than 17,000 U.S. men, those who ate more ultra-processed foods, including soft drinks, packaged snacks, cereals, and processed meats, had roughly 24% to 31% higher risks of prostate cancer after accounting for factors such as age, smoking, race and ethnicity, and poverty status. Share ultra-processed foods, UPFs, now supply nearly 60% of the calories consumed by adults in the United States and about 70% of those consumed by children. These industrially produced foods include soft drinks, packaged cereals, snacks, and processed meats. They are typically made with refined fats, oils, sugars, starches, salts, and other additives designed to improve flavor, texture, and shelf life, often while lowering nutritional quality. A growing body of research has connected greater UPF consumption with a variety of health problems. Scientists have proposed SAB. Smart nanoparticles light up brain cancer and destroy what surgery misses. Smart nanoparticles light up brain cancer and destroy what surgery misses. Smart nanoparticles helped surgeons find hidden brain cancer cells and then destroy what surgery left behind, producing striking results in mice. August 27, 2026. Source: University of Technology Sydney. Summary: scientists created smart nanoparticles that can both illuminate hidden glioblastoma cells during surgery and destroy microscopic cancer left behind afterward. In mice, the treatment prevented recurrence and led to 100% survival at 60 days, though it has not yet been tested in humans. Share: glioblastoma is considered the most aggressive type of brain cancer. One reason it is so difficult to treat is that cancer cells spread into nearby brain tissue. That makes complete surgical removal extremely challenging, because surgeons must avoid damaging healthy areas of the brain. The blood-brain barrier creates another obstacle by restricting how effectively drugs and radiotherapy can reach the tumor. Together, these challenges help explain why the 5-year survival rate is only about 7%. A two-function nanoparticle platform. Researchers at the University of Technology Sydney, UTS. Vitamin C won't prevent most colds, but it may do one small thing. Vitamin C won't prevent most colds, but it may do one small thing. Date: August 27, 2026. Source: The Conversation's. Summary: the belief that huge doses of vitamin C can ward off colds was popularized more than 50 years ago by Nobel Prize winner Linus Pauling. Since then, larger studies have found that vitamin C does not prevent most people from catching a cold, although regularly taking it may make severe symptoms slightly shorter or milder. Share: from the first hint of cold winter mornings, supermarkets and pharmacies begin heavy marketing to coax us to stock up on vitamin C to get through the cold and flu season. But where did that idea come from? As we'll see, it's a story including a Nobel Prize winner, a book, and some claims that don't quite stack up. Nobel Prize winner writes a book. Linus Pauling was a chemist from the United States who won 2 Nobel Prizes. One was in 1954 for chemistry, for his research into chemical bonds. The other was in 1962 for peace, for his activism against nuclear weapons testing. He was not a dietitian or an infectious disease physician. But that didn't stop him publishing a book on vitamin C and colds in 1970. This book is widely credited. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.